Those are just homicides over the past 4 years. I think many of the underlying causes of violence really have to be understood. When we think about concentrated poverty, educational disparities, or lack of green space or fresh food opportunities, historic policies like redlining that segregated our community, violence is a symptom of these things. We talk a lot about violence being a public health issue. So it means that violence spreads like the flu. When one person's impacted by violence, they have a network, whether that's family or friends, that are also affected. And so it begins to spread in that way. And if there are public health approaches to address the flu, then there ought to be public health approaches to address violence, and there are. One step is that you get really clear on the data in your city around violence. Who's impacted by violence predominantly? Where is violence being concentrated? What are your age ranges? What's your demography? The other part of it is, how do you decrease the risk? For the flu, you get a flu shot. And for violence, you got to get a mentor in somebody's life. You got to make sure they have economic opportunities. You got to make sure they have educational opportunities. These are the things that reduce the risk that a person will be impacted. The next step is you have to test a strategy and you figure out, are you seeing some good results? For example, Pivot to Peace. You've got folks who are working at the hospital with people who are injured and really working with them to ensure that they don't return to the hospital with an additional injury. So they're doing case management and other forms of support. Pivot to Peace has a 95% success rate. Given the success rate of Pivot to Peace, we should make sure it's at scale at our Trauma One hospital, and then we should make sure it's accessible to all hospitals. It is daunting because part of it is thinking about those individual level and interpersonal level dynamics, but then what about my neighborhood and my community and society at large, or institutions? So although it's a broad challenge, I think there are these very specific ways that we can engage it and demonstrate some really great outcomes. Neighborhoods don't have to experience concentrated violence. It doesn't have to be that way. Everybody deserves a safe neighborhood. Our goals are very much related to developing action plans that are engaging multiple parts of our city. And a lot of our goals focus around youth development, interrupting violence before it happens, supporting civic engagement, and also supporting individuals who are returning to society. A lot of our work is really sort of inclusive of everyone. This isn't a challenge that we can tackle alone, and so how does everyone see themselves in the work, and how does everyone find a way to be the one so that they can really make a difference?